what happens during erectile dysfunction is there a decrease of blood supply to the area. So we have certain vessels that supply blood to the penis. When those blood vessels are either plaqued or they're being choked off by the actual tissue around them, the blood flow isn't happening. So what we try to do is bring new collateralizations or new blood flow to the area and break up the plaque that's in there, causing the decrease in blood supply. It occurs on for many different reasons. One of the reasons, if you're taking Viagra Cialis for a very long time, your body will depend on that medication for it to happen. So all the spontaneity of sex is now taken out of the equation when you start to get into those drugs and depending on those drugs. The second thing is disease processes such as diabetes, cardiovascular disease, and many other issues. Sometimes obesity plays a very large role in all these other diseases, and blood supply is the most important thing. As men age, our testosterone starts to decrease just as father time decreases many other things in our body. And hormones are very, very important. Testosterone helps the reproduction of cells. And if your testosterone is low, cell reproduction slows down, and then you start to age. So we want to reverse that. It also helps with erectile dysfunction, with energy and focus. So most men lose their energy somewhere around 40, and all of a sudden they're wondering why, because their testosterone is dipping. Then around 2:30 in the afternoon, you may start to feel tired. When you're on testosterone, you don't feel tired. You feel like you have the energy to go to the gym, to get up and do the things that you need to do every day, to focus on your work, to be successful in life. So testosterone is a very important hormone. So to remain healthy by keeping your testosterone levels up, keeping your weight down, and hopefully exercising. Sometimes injury can also be a factor, and genetics also plays a role. So the three most common questions are: 1, can you help me? 2, have I been able to come off this medication I've been taking for years? Will it affect me when I do come off the medication? And 3 is, how long will it affect me as far as if I do the treatment, will it last for a certain period of time? If you have your wife and your kids at home and you're not able to have an erection and you become depressed because of it, then your family starts to feel that. Your wife, she's not feeling intimate with you, you're not having sexual relationships with her, or relations with her, I should say. Therefore, you become more and more angry in many ways because you cannot. So it can affect the whole family. Your children can see it, your friends, the rest of your family. It's something that's not only demeaning, but depressing for most people. As a man, men mostly are the leaders of the family. It's very, demeaning to a man not to be able to have an erection and to fulfill his partner's wishes and sexual needs. So the first thing a man has to understand, it's not his fault. Secondly, that there's help, and we're out there to help you, and we can turn this around for you and give you back your normal sex life and make you feel like you're whole again. Depending upon how deficient you are in blood supply, pretty much dictates the outcome. Patients that have diabetes, sometimes the outcomes aren't as prevalent as someone who is not suffering from a disease that would inhibit the blood flow to the area. Usually though, we would see a reaction or some type of improvement within the first month, if not sooner, for most patients. If you're looking for something that's going to be long-lasting and to react quickly, just as if you were like in your 20s, this is a great way to go. It's non-surgical, it's medication-free, where medications are basically band-aids to try to fix the problem, and it doesn't. So this fixes the issue. We treat erectile dysfunction in many ways. The first thing, we use acoustic sound wave, utilizing Gaines wave, and then we also utilize the P-shot. Also, sometimes psychologically, patients have an issue. So we talk to patients about certain things in their lives and see if we can break through those barriers. We have tremendous experience in doing this. We've treated thousands of men in the past for this treatment, for this type of issue, and we understand that there are many causes, and we're not just treating the symptoms, we're getting right to the cause of the issue.